Hi, I'm Dr. Rashmi Pawar. I'm a specialist gynecologist and a PCOS mindset coach. So, in this video, I'm going to talk about myself so that you can get to know me better. Like, who am I? Where am I from? What have I done so far? And how I can help you. So, to begin with, I am a doctor for almost 15 years. Yeah. My education has been for I think 10 years after school. So I am an Asian, South Asian by origin, Indian by origin specifically, who's based in Abu Dhabi, UAE. I'm born and brought up in Mumbai. I was born in Borivali. Um, I lived for the first 7-8 years with my grandparents while my parents were working. So I was married later on into Thana. So I'm a Marathi mulgi. I'm a Maharashtrian. Um, apart from that, I am right now 42 years of age. As of in April of 2024, I am brown in color, like globally. I am around 154 centimeters tall, around 5 feet 1.5 inches. I have always been short. Both my parents are short. I have always been in the first row in my school. Apart from that, I'm a firstborn to my family. I have two more siblings, so we are three of us. I have another brother who is 1 year younger than me, and I have a sister who is 6 years younger than me. All of us in my family are doctors. My father is an OBGYN doctor. My mom is a GP who is a hospital administrator. We have a nursing home in India, actually three we used to have, now not much functioning. My brother was an Ayurvedic doctor who's now into IT and quality. My sister is also an OBGYN doctor who is now based in UK. My brother is in America. My mom, dad are in Mumbai. I'm in Abu Dhabi. So we all over the place. We are all over the place. I am married to Pritesh. He is not a doctor. Because I have been with so many doctors, I had decided I will not marry a doctor. I have seen what happens in doctor families and I was not interested. I wanted someone who will show me outside world. And he has been doing that for the last 15 years. We've been together. We got to know each other. It's an arranged marriage, like our parents arranged for us to meet. Indians do have arranged marriages. He thinks it's a love marriage, but I think it's an arranged marriage. Like, I arranged to be married to him almost in a week's time. I decided he's the guy. Our parents met, we decided, and we got married after a year. We have a child, Mia. She's around 6 years right now. We all live in Abu Dhabi. My parents live in India. My in-laws live in India. And I live in Abu Dhabi. So apart from that, now my work life. I studied in Children's Academy in Mumbai. Then I went to Ruparel College in Matunga. And then I studied MBBS in St. GSK Medical College, that is Gordon Das, Sundar Das Medical College, that is KEM Hospital in Parel. And then I did my master's, my MS also from the same college in KEM Hospital and in Wadia Hospital. I did my FCPS, DGO, and then DNB also in the same college. After that, I worked in BMC in Borivali Maternity Home for almost 2 years as an assistant honorary consultant, where I helped out a lot of poor people. I operated on them, I delivered them, I took care of them for almost 2 years, not as a full-time employee there, but as an honorary consultant. At the same time, for 4 years, I was under the mentorship of my father, and I was working with him, following him around in different hospitals, in his own nursing home, to become an OBGYN, because he's an OBGYN consultant. After that, I left Mumbai in 2012, and I came to Dubai. I worked as a specialist gynecologist in Zuleika Hospital, where I got to do so much of independent independent work as a specialist. Then I left the hospital-based practice because it was a bit too much for an independent doctor. So I went to a clinic-based practice. I joined Aster Medical Center. I was in JLT. So if any one of you are in Dubai and are from JLT or from Dubai and you know JLT, comment below and say hi. So I was in JLT for almost 2 years. I had a fun practice there, and then at that time I got an opportunity to come to Cornish Hospital. While I was in Aster JLT, I was delivering my patients and operating on them in Medcare Hospital and Aster Hospital. Then I came to Cornish Hospital and Abu Dhabi, since I came to Abu Dhabi, I loved Abu Dhabi so much, I never left it. So I've been here for almost 12 years now. Sorry, not 12 years, 10 years now. 2015, I came here. I joined Cornish Hospital. It's a tertiary level hospital, lovely hospital, catering to only high-risk obstetrics, high-risk cases, a lot of high-risk obstetrics. That's where I came across so many metabolic diseases like diabetes, obesity, hypertension, and I was like, wow, this is a big problem. We were seeing a lot of complicated cases from all over UAE in this one place. So that's where I worked. I left Cornish around 2022, and then I was attached to a medical center just to keep my license on. I am still attached to All Care Medical Center. I see their patients on and off. So that's my medical journey. By the way, I came first, in case that matters to you, in my MS, in my hospital, and in university, I came second. So that was fun. Apart from that, now let's talk about my weight loss journey. So I have always been a skinny child, and hold on. So I have always been skinny. Like when I was born, my mom said I was like around 4 kilos big. So I think that's where she probably had diabetes in pregnancy, and that's why I had PCOS. But while growing up, I was always skinny. I think from my age of 5 to 11, 12, that's when I was skinny. I got my period by around age 12 years, I guess. And then I was still skinny till I was in my medical college. I think when when I was around 20 years old, that's when I started gaining weight a little bit. When I was 23, I started having hair loss over here. So that's where the PCOS thing started for me probably. And PCOS was not so well known that time. My periods were not frankly irregular. They used to come infrequently, but it used to be like a 30-day cycle, 35-day cycle. So there was slight irregularity there. I still didn't know that I had PCOS. Now, the whole time while I was in India, because I always thought I was fat. I was normal BMI. I had some tummy fat, and I thought I was fat. It's when I came to UAE when I drastically gained a lot of weight. I started eating a lot of those rich foods, and there was like a transformation already. There were like food available everywhere, rich, carbohydrate rich, oil rich, cheesy, pasta, all of that I started to have, and I started to gain a lot of weight. So I gained around, I used to be, when I was in India, I used to be around 53, 54 kilos, 55 kilos max. In UAE, I came in a matter of a year, I became like 67, 68 kilos. So by the time I got pregnant, I was like after delivery, I was around 73 kilos. So I had no clue why I was gaining weight and what was happening. I just knew I was eating a lot and I was not exercising at all. I couldn't get myself to exercise at all. But I always had this body image issues with my tummy fat, which I still have, and that just worsened with that weight gain. Apart from that, when I was, we decided to not have a baby. Like my husband didn't want to have a baby to begin with. He told me before marriage that. And I was like, I'm going to have 2 kids, at least 2. So we both agreed to disagree, and we decided to still marry each other. And I think 7 years down in marriage, we decided, okay, we'll have a kid. When I saw my brother's kid, and then I was like, wow, this is amazing. This feels good to have a kid in your life. That's when I decided to have a child. And I struggled. I couldn't get pregnant in spite of being an expert in fertility. I couldn't get pregnant. I had to undergo fertility treatment, IVF, failed IVFs, and that's when I got to know that I have such bad insulin resistance and PCOS. I was on metformin when I got pregnant. I got pregnant naturally, surprisingly, after an IVF cycle. It's very common. And then in the whole pregnancy, I barely gained much weight, and that was purely because I was labeled as gestational diabetes and I was monitoring myself. So I got to know how my body reacts to sugar while I was monitoring, and I got to know the foods which really spike my sugar. And I sometimes think that having pregnancy diabetes can be a blessing in disguise, because you get to know about what your future is going to look like. My mom is morbidly obese as of now. My father is still normal, everything, no medical conditions, but I get that genetic inheritance from my mother to be morbidly obese. So I have to do the work. All three of us are in the spectrum of insulin resistance, all three siblings. So, and apart from that, my husband has both side diabetes. So my child got both the risk factors of diabetes and pre-diabetes and PCOS from both her parents. So my pregnancy was, I was working throughout pregnancy. I was doing at least one night shifts, high risk work, labor delivery, stressful, operation theaters, seeing a lot of blood, stressful situations, people dying, all of that I did while being pregnant. The whole time I didn't really care much until my blood pressure started shooting up at the end. My baby was growth restricted, which was missed out. In spite of me being a doctor, me working in a OB/GYN hospital, it was completely missed out. When I had a cesarean section, I wanted a cesarean section because that's what most Indian doctors would get, because they were so scared of normal delivery. So we would get cesarean section. So that's what I did. I got a cesarean section. My cesarean section was absolutely fine. The worst part was the breastfeeding, because I was in a breastfeeding friendly hospital. We were sort of like taught that breastfeeding is important, which it is, but nobody really supports you while you go through the struggles of breastfeeding. So luckily all of my friends and nurses and doctors, they supported me in this journey. The whole lactation department in Cornish Hospital supported me while I went through this difficult part. My baby was growth restricted. She turned out to be just 2.4 kilos, so it took her quite some time to be in the normal percentile growth, to pick up her growth, but she did. She's now 6.5 years old. So Mia was born in 2018, and I was breastfeeding her. First 4 months were the hardest, but then after 4 months, I had an option to let go of breastfeeding. But by that time, I had figured out breastfeeding. I was like, I'm never leaving this thing ever again. It feels amazing. And my daughter becomes quiet, especially when I breastfeed her. So I continued breastfeeding her for almost 2.5 years. It's when the pandemic happened, that's when I stopped it. I struggled through yeast infections throughout and blocked ducts throughout. Apart from that, when she was 10 months old and I saw my supply dipping, that's when I decided to lose weight. So in 2019, 2020, I lost around 22 kilos of weight. So the initial weight loss was with just intermittent fasting and 2 meals a day. That's it. That was enough for me to lose weight because I used to eat so much. And I lost around 15 kilos with that. And then I was listening to a physician who was teaching life coaching tools to lose weight. And I was like, oh my God, her free content is helping people so much. I lost weight. I want to do what she's doing. And that's where I decided to become a life coach. So in 2020, I became a life coach with the Life Coach School in America. And I started an Instagram page and a Facebook page called Metabolic Coach. And I used to create content over there to educate people around me about weight loss and some mindset. In 2021, I decided to go gray because I was using minoxidil for my hair loss, and I was just like, okay, this hair thing is becoming gray every 2 weeks. And I was like, I'm not interested in like bombarding myself with chemicals every 2 weeks. Like once in 3-4 months is okay, but every 2 weeks I can't do that. And I was too lazy. So I was like, I'm just not gonna color anymore. I found some women, hashtag going gray hair movement. So there were a lot of young women going gray, and I started following them, and I was like, I can do this. So while I was transitioning with my gray hair, I had to go through a lot of drama. A lot of people, a lot of my patients, a lot of my doctors, colleagues, nurses came to me, my family, my mom, my dad, my in-laws, they all came to me and say, what are you doing? Why are you doing this? But I had already faced that sort of criticism from them when I was losing weight. There were people who said that it's not looking good, it's looking ugly, you should stop doing this, why are you doing this? And then I was like, okay, but weight loss is good, it's good for my heart. And that's why I continued doing this work of weight loss. I kept it off even when people said that it was bad. I continued doing the same work for my hair because it's about me, right? It's not about them. So since May of 2021, I have not colored my hair. In 2022, I became a master coach to understand the coaching tools in depth with again the Life Coach School. I left my clinical practice as a full-time physician in 2022. I took a break of around 3-4 months where I did nothing. But just like clean up my mind, and I had few clients. I was just doing that. Apart from that, in 2023, November 2022, I got a coach position, contract coach position for my school. So I got to practice her tools more and more on her clients. So I mastered coaching over almost like more than a year, and I'm still working with them as a part-time coach. So I've gotten so good at my coaching skills. Now, in 2022 November, I established my business of Dr. Rashmi Pawar Coach, OBGYN Coach LLC with Shams Free Zone in Sharjah. After that, so now I have this established coaching practice where I coach PCOS women on their mindset so that they can eat better, sleep better, move better, so that they can take control of their body, because they are someone who is going to be predisposed to weight gain around the kind of food that you are having around you. So as long as you have this kind of food easily available for you, which is like toxic for your body, you need to manage your mind. And I want you and everyone who is suffering with PCOS, prediabetes, obesity, hypertension, to learn to manage your mind around food, because that's something which is in our control. The world will keep evolving. So I have a podcast, a YouTube channel called Dr. Rashmi Pawar OBGYN Coach. You're probably watching me here. And 2 pages where I provide a lot of free content. Please consume it. There is a PCOS to pregnancy course on my YouTube page. There is a reverse PCOS series from episode 49 to 54 on my podcast page. There is a pregnancy mindset coaching page I have on YouTube. So you can consume a lot of information there to educate yourself around mindset. And if you want immediate support and you want me to come and coach you on your journey specifically until you get to the goal that you want, please get in touch with me and book a consult call. All right, that's it for today. I will see you next time. Bye-bye.